Hi, my name is Seth Gray, and I'm a cardiac intensivist at the Hospital for Sick Children. We know that family mental health and psychosocial support really does affect children's outcomes. And so here at SickKids, we're working really hard at bringing families into the circle of care. And to do this, we've actually created the Family Liaison role within the intensive care unit. And with that, I'd like to introduce you to our Family Liaison, Amy Zubick. So Amy, can you tell me a little bit about your role as the Family Liaison?
Yeah, so I see the role of a family liaison in the critical care unit as primarily a peer support to bridge gaps for families. Sometimes it's practical things like showing them their way around. Sometimes it's about bridging knowledge gaps. What are the resources that are available to me? Where can I get a snack and how can I get a discount on my parking? But all of these kinds of things that show that they are welcome in the unit.
What drew you to become a Family Liaison member here?
So on May 25th, 2016, my whole life exploded. And on that day, I went for a routine ultrasound on my third child. The only thing I was thinking about results-wise is that we didn't want to know the sex of our baby. And then I came out of that ultrasound with the knowledge that my child had a congenital heart defect. I honestly went in as one person and came out as another, because now I was becoming a heart mom. This diagnosis changed everything for me. And so I suddenly felt really isolated. And the thing that really helped me in that moment was starting to connect with other families. They said, this is my son with transposition who is learning to crawl at 10 months. This is my child when he was playing hockey. All of those things that suddenly made me realize that maybe I could have permission to hope, that my child could grow and could live. And I don't think anyone could give that to me other than families who had gone through some similar experiences.
Absolutely.
When this role was announced, it just felt like exactly what I had been hoping for. This was the best way to give back to the heart community that gave so much to me.
You know, you've talked a lot about building bridges, you've talked a lot about peer support, but what does that look like on a daily basis when you come into work?
Each morning I log into Epic and print off a list of the patients that are currently in the unit. And what I usually do is first focus on the newest admissions, because those people are the ones that need the connection the most. A little bit later in the morning, I connect with the charge nurse and social work and child life, and we go over the list of all the patients so that I can understand the priorities, who's coming, who's going, and then I just go into connecting with those families. One of the things I try to do when I get there is look at their child and make some comment to let them know that I see their child and say, oh wow, you know, they were born with such a beautiful full head of hair, and make sure that I say congratulations. Something that is really hard when you have a child with a critical condition is that a lot of people that you know are saying sorry. And it's really important to have families hear congratulations as well. That's one of the things that I do just as part of my introduction. And then I usually also say, my son has also been a patient here, and I'm here to help you navigate your time in the hospital.
What other touch points or times do you stop by and see them?
So I try to do regular peer support check-ins daily if possible, but I also try to focus on certain pivotal times in their stay. So especially if I know that a surgery is coming up for a family. And then another marker of a time that I like to check in with families is when their child is ready to move out of ICU and into the ward.
And can you tell me a little bit more about some of the other things that I've seen you do supporting families? And I've seen you doing some, looks like storyboarding time or craft time. Can you describe that a little bit more?
One of my favorite things to do with families is family storyboards. They just start with a big white board, and I have a photo printer. Some people put their child's name and a picture of their home. Sometimes it's pictures of the journey. So this was, day one after surgery. This is when baby got extubated. This was his first bath. But what I really like about storyboards is that it's a place where families get to make all the choices. It feels like a hospital admission takes so much away from families, but when I hand someone a storyboard, they're in charge of all of it.
Yes.
And giving back some of that control and autonomy in a time of helplessness has been so amazing to see.
Well, and as a physician, from my standpoint, gives us a nice moment to step back and look at the child within the family context, to bring some of the family perspective to the bedside as well, even if it's not a direct conversation.
And it's just that opportunity for connection, that before we just saw this sedated, intubated child and we didn't know his story, but those pictures start to be a window into understanding that story.
I see you on a lot of committees as well, whether it's the quality and safety meeting, the EDI meetings that we have. Why is it important to have a family member at these tables?
People will say, oh, I think we're doing really well at this or that. And I'll be able to say, well, I heard this feedback from this family. I'm wondering if there's a way we can do better. And it's been really validating and really honoring to hear the leadership say that they value the family feedback and change some of the practices and the ways that they speak to and help families.
We've been talking a lot about what your day looks like, but I have to ask, why do you think this matters? I
think the biggest reason that it matters is to help people feel less alone in the middle of a very isolating time. I sometimes introduce myself to people as a parent in the neighborhood.
Yeah.
Say like, I've walked these streets. This is a very strange neighborhood to be a parent. It's probably one of the hardest places to be a parent. So I think that sense of bringing community is huge.
As someone who's had a child with congenital heart disease and been through this, how do you think hospitalization affects a parent's mental health?
People come into this experience with their whole mental health history. And you see many families who come in and it's obvious that they are struggling. But then there are other families who get described as lovely families and they are presenting very well. Sometimes it just means in those situations that they're hiding it better. And sometimes also the trauma comes out later. And it reminds me of this experience when I went back to our regular cardiologist appointment and he's like, everything looks good, no restrictions, and then I was like, and he's like, you weren't expecting that? And I said, every time I come here, I think the bubble's gonna burst. And he looked at me and he said, you've been through trauma and trauma changes a person. And hearing that acknowledged was the best thing that could happen to me on that day. I think that gave me permission to pursue therapy for myself. And so I also can kind of preemptively say some of those things to families and say, like, this takes a lot out of you, and can then direct them to social work again for those resources. But like most of all, as a peer support person, to just normalize that.
As someone who's been through it from a peer support role, I can't think of a better way to actually support a family within that circle of care, and to give that, that hope as you talk about, that there is a way through this.
And I think like at the beginning, at that stage when you're wondering, will my child survive this? There's this other question in the back of your mind of like, will I survive this? Because I've never done anything like this before. And something about seeing others who have walked that road gives you that permission to hope that maybe I can survive this. Maybe we all can.
Well, thanks, Amy. We appreciate what you do, and so glad to have you on the team as one supporting our families in ways that those without the experience wouldn't have that background. So thank you.
Thank you. It's an honor to be here.